All right, if you're an athlete and you're having medial knee pain or patella pain, this video is for you. This is going to help open up those hips, decreasing the irritation on that medial knee. Let's get into it. All you're going to need is a band and some floor space. Let's test something. Let's test your internal and external rotation. What you want to do is sit on the ground, put your hip in hip flexion, and then your knee in about 90 degrees of flexion. Same thing with your back hip, 90 degrees here, 90 degrees here. What you want to do is try to push in, and then do you feel any pinching or tightness anywhere? And if you do, then I want you to try to rotate and then check the other side. If you feel any tightness or pinching anywhere, make note of that, because we're going to help improve this, which is going to help take pressure off that knee. Let's get into it. So, we're going to get into what we call a hip distraction. You're going to get you a band, and you're going to do this for both sides. It'll be about 45 seconds of work, okay? So you're going to put that band, step into it. You're going to get it on the front hip, in that front hip crease, and you're going to step out. You want a good amount of tension here. And you want to rock back and forth for about 45 seconds. Should start to feel a little bit of a burn, shouldn't be any pain. Then we'll get into the other side, step into it, same situation, putting it in that crease. All right, great. So we got that done. So now we're going to go back into the hip 90-90, and we're going to do what's called active lift-offs. 3 different grades of this. You can either lean back, try to lift that ankle off. You see how that ankle pulls off? If you can do that, you can lean forward to make it a little bit harder. Try to lift that ankle off. It's a lot harder when you're leaning forward versus back. I'm going to lean back and let my ankle hold off, pushing that knee down. 1, 2, 3, relax. We'll rotate it to the other side. Do the same thing. If you want to have a little more difficulty, lean forward. But if you need a little less difficulty, lean back. Pushing into it. 1, 2, 3. Great. All right. So we've opened up external rotation. Now we got to get into internal rotation. What you want to do now, take that same band, we pull it sideways, laterally, away from the hip. Now we're going to pull it back posteriorly, okay? So we're going to put that, step into it with this right foot. We're going to get into a rocker. Put your toes together. The band is pulling your hip back. It's in that hip crease. Your shins are kind of angled out. Knees are angled out. And what I want you to do is just go forward and back. Just gentle rocking. We're going to do this for about 45 seconds here. All right, so the last second, we're going to swap. Same situation here. Make sure it's in the hip crease, high as you can go. Toes together, chins angled out, and let's begin. That's it for that one. So now we're going to go same into that 90-90 that we were in before. But now instead of the front leg, we're going to work on the back leg. We're working on internal rotation. So what I want you to do is I want you to push your knee in, lifting the ankle off, okay? You're going to hold it for 3 seconds, slowly back down. So rotate back through. You'll be able to see on this side really well what we're doing. We're pushing in, 2, 3, slowly lower back down. And one more, 1, 2, 3, slowly lower back down. So finally, we're going to retest that. We've done the mobility work, done everything correctly. You should have more mobility. You should have less pinching and more mobility in your hips in internal rotation and in external rotation. So even leaning over and coming back down. So I feel less tight. This is early morning routine, of course, right before a game or even after a game. Will help loosen you up, get you prepared, decrease the risk of injury. Also help with medial knee pain if you're having any of that. So this is Alex Panel. I'm with the Panel Performance Group. If you'd like this content and if you want to see more things like this, comment what you want to see. I'm here to serve, and hopefully this video helps you or helps somebody else. Thanks for watching.